In fact, in Ghana, we've diluted everything. You don't just get up and say you're a breeder. If you delay in vaccinations, there are consequences. When you bring your puppy here for parvo treatment, if I touch that puppy...
What's the chance of them surviving?
Oh, for me, I always say, Papa, you start rattling, then the client is like, you are good. Meanwhile, rabid cats can come to your compound.
Wow.
Rabid bats can come to your compound. They'll be fighting with your dog. You have to run brucella test to know. You have to do vaginal swab. Now we've added progesterone test.
Yeah. So puppies are always nice and adorable when they are small, especially for pet owners who buy them from breeders that they've already gone through the process. But the period before they grow is not really talked about that much. And today I'll be having this session with Dr. Koney. I don't have the right words to describe you, so I would want you yourself to tell us about yourself.
I'm just Dr. Koney. So you can just go on.
Okay, it's a pleasure having this session with you. And I would want us to dive into your journey to becoming a vet. Which animal did you start with?
I've always loved dogs and cats.
Okay.
So, and my dad was also a vet. So sometimes you follow him to do 1 or 2 cases. You hold, you assist. Assist in court. I wasn't a vet, so yeah. But then you observe what he does, and then I fell in love with the work. And I also love animals, so it became easier for me to adapt.
So it was like a family thing?
Sort of.
Sort of? Yeah. Although not everyone still are animal people.
To be a vet, you have to love animals. You have to love what you are doing so that you can even explain better. You can anticipate what will happen. But if you don't love the animal you are working with, I don't think you do a good job. So first and foremost, you have to love animals. Yeah.
Okay, so which breed of dog would you say is your favorite?
I have Labradors, so
they are your favorite.
Yeah, but German Shepherds are cool.
Also
Boer Bulls are also very nice. Great Danes are super gorgeous.
Okay, so I want us to talk about the pet owners. So before you decide to breed a dog, which kind of person should you be?
First of all, in fact, in Ghana, we've diluted everything. You don't just get up and say you're a breeder. You have to have time. You have to have the passion. You have to have what it takes to breed. You don't just breed any dog. You have to do DNA and stuff. Just like maybe you have a wife, you want to produce. Yes. In fact, before you get married, you have to do some tests and all that to see compatibility and all that. That's a correct breeder or a true breeder. That's what the processes we have to go through. In Ghana, I buy a female, you have a male, we meet somewhere. Oh, your male is very beautiful. How old is he? How old is she? When she comes in heat, can we cross? Oh, there is a deal there. Maybe even these 2 dogs are related. Maybe they are cousins. Maybe they are siblings. We don't even ask, where did you get yours? Where did I get mine? No. They are beautiful. It's a male and a female. And it's only a male and female that can reproduce. And you want the money, so why not? If I get 10 puppies here times so amount, oh, that's good money. And then, we go into breeding. But the nitty-gritty of even rearing the dog or bitch to become an adult to reproduce, we don't think about that. And it's very hectic.
Very, very hectic. So what's your take on mixed breed? Because pet owners, one may have a German Shepherd, sees a nice Rottweiler, and they just said, as you said, they just decide to cross it.
You see, everything is about genetics and hormones. There are some people of the view that when you mix, that is crossbreed, they are stronger than the purebreds. Some will also tell you the purebreds are better than the mixed one because he's taking maybe a recessive from this parent and then mixes with another recessive. So whatever you are producing, you can't even, fathom. You can't describe what it is. That's why some of the mixed breeds, they are, he has two different characters. Today he's quiet, tomorrow, So, but then if you get a pure breed, the mother is like this, the father is like this, then okay, you are buying this for the family, or you are buying this as a working dog, security dog and stuff. Yeah. Even in a litter, you have different characters.
Very true.
Yeah. So that's why selling puppies too young to becomes detrimental, moving forward or in the future.
Yeah,
because
I'll ask a question around that.
Yeah, you go and then, I like this puppy. Because it's young, you don't see the characters well. You don't see it well. That's why I said a proper breeder might be able to tell.
Yeah.
But if I'm just a dog lover, they give him birth, Charlie. Take one. Pick one. It's 3,000. It's 2,000. It's whatever thousands. You pay, you go. Then later you are like, the dog I bought was very aggressive, but the mother was cool. So how come? But you see, he's also taking something from the father. So we have to take our time to know the characters and then sell them off or rehome them to the appropriate homes. Yeah.
Okay. So using myself as an example, I've done the due diligence, 2 German Shepherds. And I want to breed them. What possible tests should I start before I even decide to mate the female?
Okay, first of all, you said due diligence. So maybe somebody will not understand your the word due diligence. They are from different lines.
Okay.
They should be from different lines, not related in any way. You should know their grandparents, great-grandparents, their parents, and now them. Then you have to run brucella test to know the patient is fertile.
Okay.
Because brucella causes abortion. Yeah. It's an infection that causes abortion. You have to do vaginal swab to see whether there's any infection in the vagina. Because the sperm will have to go through a clean vagina into the uterus, through the fallopian tube, and then there's implantation and all that in the uterus. Yeah. So once you've done all these tests, and then now we've added progesterone test.
Yeah.
Progesterone will tell you when to mate, because we are anticipating you have quite a number of eggs available. So that when you mate and the sperms are good, you're able to fertilize all the eggs, and then you have big numbers.
Yeah.
So now you've done all the tests, and then let me not also forget, maybe you do some complete blood count to see if there's any hemoparasite, blood parasite like babesia, tick fever, leakia, because all these tick fevers, is tick fever, but they have different they can also cause abortion. Okay. You can lose the bitch, and once you lose the bitch, you've lost all the puppies.
Generation is gone.
That's it. So for me, I advise clients that before you mate, you run all these tests. You also deworm and give anti-tick and flea medication before you mate. You deworm every 2 to 3 months. So it means once you deworm before mating, the deworming that you've done will take care of all the worms and gestation period is 57 to 64 days. So that's about 2 months. Yeah. And we said deworming is between 2 to 3 months.
So you can cover the whole period.
That's it. You also give tick and flea control. You do tick and flea control, and most of the medication also run 2 to 3 months. So once you do that, the bitch is covered. So you don't have any problems. Yeah. Now the bitch is pregnant. You also have to take care of the pregnant bitch by giving good food. You also supplement, because now the puppies are growing. You want good litter. You want nice litter, big, So you feed well. You give all the supplements that are needed: fish oil, blue seeds, all. Even blood tonic, because they are also exchanging blood. They are taking blood
from. I also did. I gave blood tonic.
Yeah, they are taking blood from the parent and all. So, and calcium sometimes, depending on the stage of pregnancy. Yeah.
I delivered my puppies at your end. It was a very huge litter. I delayed before bringing the dog for the CS. And you mentioned this. If it was my wife, is this how long I would have kept? I'm a new pet owner. When will I realize this is the period I need to rush my dog to the hospital?
If you do a scan and there are more than 8 puppies, please just do a CS.
And be free.
Yeah, because the bitch will get tired.
It's true.
Even you yourself, you get tired because you are sitting waiting for puppies to come.
3-4 hours, still waiting.
Sometimes even more.
Yeah.
A bitch will start giving birth at 9 and will finish at 5 a.m. You've not slept. She has not slept. So now he's going to take care of the puppies.
Everybody's tired.
But if by day 60, for me, if the bitch has not given birth by day 60, just go in for CS.
And be free.
Within an hour, you get all your puppies. Everybody is strong enough to take care of everybody. Yes. The vet is strong enough to advise. The owner is strong enough to be putting the puppies at the teats. The mother is also strong enough to be licking the puppies to keep them dry and warm. So it's as easy as that. We try to make things difficult for ourselves.
It's always us.
It's always about the money and all that. Yeah. And also, once you meet your bitch, you should let your vet know that, okay, this is what I've done. If your vet can do a CS, you arrange when to do it.
Yes. Okay.
If your vet can't and will refer you to another vet, the vet knows.
Okay.
Personally, if I'm seated at home relaxing on a Sunday and you call me that, I don't think I'll come. Let's be fair to each other.
Let's be real.
I don't think I'll come. Because maybe I'm not even at home, I'm not even in Accra. But if you came here, like in so many people's cases, they come, okay, when will day 60 be? It's a Sunday. Hey, doc, are you sure you'll be here? No, I said, once we've agreed. I'll be there. So it means I have to cancel some of the yes, and then be with the bitch, do my thing, and then
be free.
That's it. So let your vet know.
Yeah.
So that all the necessary, don't wait until maybe 6 weeks, 7 weeks, then you say we are going to do a scan. And maybe by then even it's a friend who told you, this bitch of yours, won't you scan to know whether she's pregnant or not? You want the puppies.
Yeah.
So you have to do everything it takes to get healthy puppies. Because at the end of the day, you want to sell the puppies and make money. So just do what it takes to get your puppy. You don't give puppy adult food. So you give puppy food. You deworm regularly. Because puppies are always picking on the floor. That is why we usually advise that you deworm every 2 weeks. As they grow, you reduce. So from 2 weeks after birth, you deworm every 2 weeks until the puppy is 6 months. Between 6 months and 1 year, you deworm every month.
Okay.
By then, he's learning not to pick just anything on the floor. Yes. Yeah. After 1 year, he's mature enough, or he or she is mature enough to know. You don't. That's why as they grow, the interval is also wider. So after 1 year, we deworm every 2 to 3 months. So now it's your choice. There are some dogs that are purely indoors.
So you're not picking.
So though they can come and sniff your shoes, lick your socks, you are from outside. You stepped. So you still have to deworm them. Then you vaccinate them. Because from the start, we have here in Ghana or here in my hospital, we start vaccinations at 6 weeks. The second one or the booster is 8 weeks.
Okay.
And then the final of the primaries is at 12 weeks.
12 weeks.
So at the 12 week, we do both DHLP and anti-rabies.
Okay.
If you don't go through this vaccination regime, you might lose your puppy. So you might not get your puppy to adulthood to go and reproduce for you.
Yeah.
If you delay in vaccinations, there are consequences. You can get parvovirus.
Yeah, parvovirus.
You can get distemper. Parvovirus affects the digestive system and also the heart. So you see that the puppy will be vomiting, having bloody diarrhea. Sometimes they have a heart attack.
What's the chance of them surviving?
Oh, for me, I always say 50-50. If you catch it early, it's a virus.
Okay.
You can't treat a virus. So what you do is you just
Manage it.
with fluids, vitamins, just to boost the immune system, for the system to fight the virus that is in the, yeah.
You mentioned December. Is it December?
Distemper. That's got to do with the CNS, the central nervous system.
Okay.
So it affects the central nervous system, the brain, the spinal cord. So usually they'll be paddling and then something like gagging or chewing flies. On seeing flies. Sometimes even their eyes become blue. So you see, you don't want to experience all these before you go to the clinic, hospital, or veterinary center. So just to avoid all this, just vaccinate. Vaccination is cheaper compared to the treatment. You might lose your puppy. You pay me big money, but you still lose your puppy. So just pay something small
and keep the dog
for
safe.
vaccination. You keep the dog safe.
This question. I had this situation where the bitch delivered naturally, but all the puppies died, and it was an infection from the mother. Is there a way you can see the milk of the mother to so this milk is infected?
Yes. You see, puppies they are small. Digestive system is not strong. So the least thing they can go. So maybe you've come to do a scan, or during CS we'll milk and then see the texture, the color, the consistency. If we are not happy with it, we take it to the lab to run tests. If we realize no, you can't clear this infection in the next 3-4 days, then we advise the client to feed externally as the mother is being treated. But if you are stubborn and you give the same infected milk, then you lose all the puppies.
So it's your fault.
Yes.
It's your fault.
So we have to check. You see, sometimes we do things last minute. So everybody is in a hurry, you forget things. But once you sit down and you discuss, because if like when I asked you if it were your wife, will you delay? You know, you in fact, your wife will go for antenatal, you'll be following her, you'll be discussing. It's the same thing.
Same thing.
Whatever we suffer from as human beings, they also suffer the same thing. So we treat them, equally. In fact, they even do better jobs for us because your dog is your therapeutic animal, security, everything. So why?
You're not even paying them. All you do is feed them and not treat them well.
And you don't feed them properly too.
Okay, so this question, a lot of breeders may not like it. At what week will you advise, or month will you advise dogs should be ready for new homes? Because people give us low at 8 weeks. They are not even done with vaccination.
For me, the best will be maybe between 3 and 4 months.
Okay.
I know people in short. That's
what I'm saying.
Who is going to feed them? But
of course.
You see, sometimes it's for your namesake that I bought a very good puppy. The puppies are good, good character. We are looking at all those things before they leave.
Yeah.
That's it. I even know there are some countries where before they sell their puppy to you, they've neutered them.
Wow.
And neutering is, after 3 months. Yeah.
Wait.
So yeah, some will even wait 6 months, 7 months before they sell and make sure they've neutered them before. Because it's Ghana that everybody can be a breeder. But there are some countries, there are specific people or specific breeders that you can buy from. Yeah. So even those countries, they will encourage you neuter your
Pups.
pet once you are not breeding. Just neuter.
Yeah. Because you can't control some.
Yes.
Pet owners like, I want a male and female, and they see they are pregnant, they are all over the place. They start struggling.
So that's it. And you see, one thing is for those who are also selling at 8 weeks.
Yeah.
There's a reason why they are doing that, though it's not the ideal.
Yeah.
But my problem here is try and vaccinate, do the necessary vaccinations. If maybe you are supposed to vaccinate, you have to do the second vaccination maybe in 2 days, 3 days. Once the new owner buys the puppy, advise them to vaccinate.
Follow up.
But you see, I want my money, so once I don't really care about what happens next. Then they rush to the vet. Oh, my dog is vomiting, he's having diarrhea. Yeah. You ask how old, sometimes they'll call you how old, is less than a year. Have you vaccinated? Oh, in the book, I can only see one. I say, okay, please rush it. We run some tests. Yes. And lo and behold, it's Parvovirus.
Wow.
And like I said, Parvo is 50-50. In fact, I am generous to say 50-50. Sometimes
what I've heard is the likeliness of them surviving is extremely low. Yeah. And the curing is the money you spend.
Yes. And even the time, and effort. Stress. Every 2 hours you have to be dripping. So it means when you bring your puppy here for Parvo treatment, if I touch that puppy, that's it. I'm not coming to the main hospital again till the puppy goes. So it means
can't take care of other dogs.
That's it. So manpower is gone just because of one puppy.
So you have to charge you accordingly.
And I'll charge you, and the puppy dies at the end. So just vaccinate and then be free. That's all. Vaccination is key.
Yeah.
Vaccinate. In fact, both the DHLP and anti-rabies. Because even with the anti-rabies, if you don't do it, the puppy will get rabies.
Yeah.
Somebody will tell you, my dog doesn't go out.
Yeah.
But your dog roams the compound.
You brought something even in the room.
Yes. And even rabid cats can come to your compound.
Wow.
Rabid bats can come to your compound. They'll be fighting with your dog. Yes, your dog will kill the cat. Your dog will kill a bat. You are happy, hey, my dog has killed the cat. But maybe before the cat died, scratched the dog.
Dog, yeah.
Yeah. And if the cat is rabid, it means he has given your dog rabies. Because and once you've not vaccinated, you contract the rabies. Later, maybe after 10, 14 days, your dog is drooling, is almost dying. You also go and, now you want to see what's wrong with your dog. You have maybe a cut or a bruise on your hand, your legs. Once the saliva enters those cuts, you also get rabies. That's how rabies is transmitted. Not a bite, but the saliva. Yeah, if you don't take care, if after 2 months, 3 months, you don't do anything about it, you are gone. And once you are showing signs of rabies, nothing can be done.
Wow.
Nothing, absolutely nothing can be done. So rabies, whether you are a doctor, you are a lawyer, you are a mechanic, you are a breeder, whatever, or whoever you are
gone.
You are gone. That's it.
Because of rabies, people are scared to even get dogs.
And you have to. if you know you can't, do
all these things.
Yeah, you have to. Because if you forget to vaccinate and your dog contracts rabies, most likely you also have it, because we play with them. And once they get the rabies, it's like he's mad. He doesn't even know what he's doing. He's just biting. So, yeah. Sometimes, there's the damp form. So they are lying down quietly, but they are harboring the virus. So once the saliva touches you on a cut surface, that's it.
Okay, so my final question, it will be a two-way question. So what advice will you give to pet owners who decide to go through this lane? And the next question will be to vets, young vets who are coming up. What will you advise them also to become great like you? Because that one you can't deny it.
Okay, thank you. Pet owners, just once you get your dog, your puppy, maybe you visit the vet. Not maybe, just go to the vet before you go home.
Okay.
Because maybe the breeder didn't tell you everything that you need to know. So just visit your nearest vet. And once you've come to me, let me be the one to, follow through. Yeah. So you go to your nearest vet, so that if anything, you can just rush there. Yeah. Seek advice, know what you can do. Because so that you don't become a nuisance. Once I know, okay, this guy, he doesn't know much about dogs. He now acquired a new puppy. I can have the patience and the time to go through. You can also call. I know, okay, it's Michael. Michael, what again? Then surely our advice. That's it. So your nearest vet, and let your vet also be your friend. So that at least I'll know, okay, it's my job to do it, but I can also bend for you, because and then to the young vets, we are taught everything. Ethics, just follow what you are taught. Just find a senior vet to learn from, a mentor, so that they can also guide you, to grow. When you're at a stage and I'm a fully fledged, I can vet and I can do everything on my own. Sometimes you even say we are great. We also seek advice, you should also be communicating with your classmates. Because you might see a case. Maybe this evening we've discussed about the case. Tomorrow I'll go and see the same thing. Then I'll be like, oh, Michael, what is it? Okay, then Papa, you start rattling. Then the client is like, you are good. Meanwhile, somebody, your friend, you discussed, and then now is there in front of you. It becomes easier. You shouldn't be a one-man soldier. You have to be discussing things. We are classmates. That's what classmates are for.
It's true.
So the smallest thing, you call, you ask. It's better to save the pet than disgrace yourself.
It's true.
If you are given a case and you see this is beyond you, just refer to the next vet. It doesn't make you a lesser vet. No, you rather learn from it. And then, you see, maybe the fear will be, oh, he has taken my client.
That's what I was about to mention. It's like you're handing your client over to them.
For me, if I refer you to Sarah, Dr. Sarah, I'll be following up with you. Oh, how is Bosco doing? You see, what we also don't know. If I do, I referred because maybe I don't have the instruments, I don't have the capacity. But once I start following up, then I say, oh, he used this. Hey, if I guess, I'm also learning. If I get more money, can I also go and purchase that instrument, so that tomorrow I don't refer. Then the money will sit by you. That's it.
It's been a very educative and insightful session with you. I mean, it's difficult to get you, but you still made time for us. God bless you so much.
Bless you too.
Nice having you too.
Thank you very much.
So it's the end of the session with Dr. Koney, and we are OUT out.